I'm Dr. B, and I want to show you some of the technologies that we are using here in Smile Solution Dentistry in Round Rock, Texas. Before we start a treatment on a patient, we bring them in for a screening. First thing first, we do a 3D scan, a CBCT. And CBCT shows everything we need to know about that patient. We can find out about the type of bone they have, if it's a soft bone or hard bone. We know about the limiting factors. We can find out all details we need to know. After having a thorough review of 3D scan, we have an intraoral scan that digitizes everything inside the mouth. Then we're gonna stitch these two together, and we do the planning to place the implants at the right place that has the best quality of bone, and we can choose the angle of implant, the type of implant, the length of implant. The most important part is that we have that understanding before we even start the surgery. Everything is pre-planned, everything is already known, so we're not dealing with any ambiguity. So our patient was in denture for a long time, and now it's the time for him to get his teeth back with implants. He doesn't need his denture anymore, but we're going to digitize this denture and have a better understanding how his bite's gonna look like after he gets his surgery done. As I mentioned before, planning is the most important part of the process. We gotta have a plan for surgery, and we gotta have a plan for after surgery for our patient's smile. So before we even start the surgery, we know what kind of smile, what kind of teeth. We gotta plan everything. The software basically helps us to have a better visual understanding of everything. It's using a 3D scan of the patient. It helps us to see what would happen when we start the surgery. How I can do a virtual extraction of the teeth. It kind of gives us the ability to have a good prediction of outcomes. So we're going to print the temporary bridge for our patient with the 3D printer. So it can happen either at the day of surgery or next day. All right, patient's teeth are ready. It just needs some polish and kind of touch up, but it's totally good to go. And the most important part is the accuracy. So it's 100% accurate. So when you put it in patient's mouth, it's gonna sit well, it's gonna work well, and it's gonna feel good. And it happens right after the surgery. All right, thank you very much for visiting us today. Come by and see us.